tax bill. Everybody wants to know why we're taking this up first and not taxes. Because it's a tax bill. That's why.
Gentleman's time has expired. The gentleman from Massachusetts reserved. Gentleman from Texas.
I would remind my friend from Connecticut that 190,000 residents of Connecticut, 2 out of 3 eligible for Obamacare, believed it failed them so bad they paid a tax or exempted themselves. I'm proud to yield 2 minutes to the gentlelady from South Dakota who's weighed in such a key way on health care, Ms. Noem.
The gentlelady from South Dakota is recognized for 2 minutes.
Thank you, Mr. Speaker. Mr. Speaker, it's no surprise that the Democrats today are upset, that they're complaining that they don't like this bill, because their number one goal all along, and I've heard them say it to me in conversations over the years, their number one goal was to go to a single-payer system. They wanted government-run health care, and we're on our track to that today. In fact, in my home state of South Dakota, at one time we had 17 options and companies that people could shop for their health care policies from. Today we have 2. We're well down our road now to giving them exactly what they want. And they hate this bill because it puts people back in control of their own health care. It doesn't let some bureaucrat in Washington, D.C. decide what treatment they can get in the future. It lets people decide that with their doctors. This is a vote today for freedom for people who have lived under the bureaucracy of the federal government, not giving them options on how to take care of themselves and their families. Rising costs, shrinking options, increasing bureaucracy under Obamacare has taken health care control away from patients, away from people, away from families struggling to pay their bills, and they're against their best in own common sense and household budgets. They're forced to pay $10,000, $15,000, $20,000 more per year for health coverage, which has a deductible so high that they don't even utilize it then, because they can no way meet the $6,500, $10,000 deductible, $12,000 deductible, so they don't even use it at all if they do have it. Their stories are reflected in all the data that we've seen. 100% of the health care options on healthcare.gov in South Dakota have seen double-digit rate increases. Meanwhile, the number of providers families have to choose from has gotten much, much worse. We have a responsibility to eliminate Obamacare's individual and employer mandates, which today's legislation does. It also abolishes the taxes that were included in Obamacare, up to $1 trillion of taxes that were put on health care in order to pay for the bill, which will be eliminated as well. If left in place, the health insurance tax alone will raise costs on families up to $5,000 over the next decade. Bipartisan congressional members have repeatedly opposed taxpayer funding of abortions, and that's fixed in this bill as well. When we talk about health care, we're talking about something very personal, which is why I want patients put back in control. With that, I yield back, Mr. Speaker.
Gentlelady's time has expired. Gentleman from Texas reserves. The gentleman from Massachusetts.
Mr. Speaker, I would remind my colleague that her vote for this bill will result in 63,000 people in South Dakota losing their health care coverage and care. With that, Mr. Speaker, I would like to acknowledge the gentleman from Oregon, a visionary, certainly, and an individual who looks forward and also helped to write the ACA, Mr. Blumenauer, for 1 minute.
The gentleman from Oregon is recognized for 1 minute.
It's come to this, considering hopelessly flawed legislation that the Republicans have had 7 years to prepare for and still couldn't do it right. It may still pass, but it's never going to be enacted because most people are figuring it out, and they don't like it, and they're being heard. That's why this bill has been stalled, and the Republicans have been forced to twist the legislation in this fashion. But the bottom line remains. Trump Care will cost more for people who need it the most. It will hurt older and lower income people in order to create tax cuts for people who need them the least. Trump Care will destabilize health insurance and will slowly but surely destroy Medicaid. It didn't have to be that way, but as long as people continue speaking out and fighting back with us, it won't be in the future, and we can have a new era in health care and in politics. With their help, it will be.
Gentleman yields back. Gentleman from Massachusetts reserves. Gentleman from Texas.
And to remind my dear friend from Oregon, 153,000 Oregonians eligible for Obamacare with generous subsidies said thank you, but no thank you. I now yield 2 minutes to my good friend and a key member of the Ways and Means Committee, the gentleman from South Carolina, Mr. Rice.
The gentleman from South Carolina is recognized for 2 minutes.
Thank you, Mr. Speaker. I stand in strong support of the American Health Care Act and urge my colleagues to vote in favor of the bill. Obamacare was built on broken promises. President Obama said you could keep your policy, keep your doctor, and it would bring down the cost of the insurance for a family of four by $2,500 per year. People, it's time for the lies to stop. Let me share with you the shameful reality of Obamacare in South Carolina. Turns out you couldn't keep your doctor. In fact, the Medical University of South Carolina is not an accepted provider under Obamacare in South Carolina. That's right. South Carolinians cannot go to the Medical University of South Carolina if they're covered by Obamacare exchange policies. Turns out you couldn't keep your policy. It's hard to believe, but more South Carolinians had their plans canceled by Obamacare than have enrolled in the exchanges. 237,000 South Carolinians' policies were canceled in Obamacare. Turns out South Carolinians did not see a $2,500 reduction in their health care premiums. In fact, premiums have increased by double digits every year since the exchange opened, and this year, premiums increased 28% and deductibles 26%. I submit to you that if you have a health insurance policy with $6,000 in deductibles and copays so high you can't afford to use your policy, regardless of the fact that statistics say you're covered, you are not covered. 206,000 South Carolinians have signed up for Obamacare, 4% of the population. 96% of South Carolinians are not on Obamacare. 3 times as many people in South Carolina have chosen to pay the mandate penalty rather than to pick up Obamacare policies. Mr. Speaker, President Obama promised South Carolinians we would have many competitive plans to choose from. But after only 3 years of Obama's damage to our healthcare system, only one provider remains, and they are threatening to pull out.
I yield an additional 15 seconds.
Gentleman's yielded in 15 seconds.
The CEO of a major hospital in South Carolina stated the way it's going right now, it's probably going to implode in the next year or two. Our state's director of insurance last year said companies have given it their best shot and can't sustain this business model, can't make a profit. The Affordable Care Act has not worked, does not work, and cannot work under this structure in South Carolina.
Gentleman's time has expired. The gentleman from Texas reserves. The gentleman from Massachusetts.
Mr. Speaker, I would remind my colleague that his vote for this bill will result in 70,000 people in his congressional district in South Carolina losing their health care coverage. Now I'd like to yield 1 minute and 30 seconds to the gentleman from Wisconsin, Mr. Kind, who is a thoughtful member of the Ways and Means Committee and lucky enough to have been educated in the state of Massachusetts.
That's right.
Gentleman from Wisconsin is recognized for a minute and a
Thank
half.
my friend for yielding. Mr. Speaker, we face a truly historic day today in the United States Congress. For the first time in our nation's history, we have a Congress working with an administration offering the American people a health care reform bill that, instead of reducing the number of uninsured in this country, increases the uninsured by 24 million people, including 431,000 in my home state of Wisconsin. And we understand why. It's a simple explanation. This is a tax cut bill for the most wealthy in the guise of health care reform. And that's unfortunate because it's a missed opportunity of fixing what isn't currently working in the health care system. And if we wanted to be honest with the American people today, we would admit that there are important, good features of the Affordable Care Act that should remain and we should not end. But there are things that need to be fixed, and we have to stay focused on reducing health care costs for all Americans. Let's continue to drive on delivery system reform and payment reform so we get better results at a better price. But a bill before us that increases the uninsured by 24 million, that delivers huge tax breaks to the most wealthy, that applies a new older American tax, especially in rural areas like mine in Wisconsin, and that robs money from the Medicare Trust Fund, is not only a missed opportunity, it is bad legislation. I encourage my colleagues to vote no. We can do better. We must do better, and I yield back.
Gentleman yields back. The gentleman from Massachusetts reserved. The gentleman from Texas recognized.
Thank you. I remind my good and thoughtful friend that 290,000 Wisconsinites chose not to get Obamacare, were willing to pay a tax to stay out of a failed health care system. I'm proud to yield 2 minutes. The gentlelady from Indiana, a new member of our committee who's doing tremendous things in health care, Ms. Walorski.
Gentlelady is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in strong support of the American Health Care Act. Yesterday marked 7 years since the Obamacare law was signed into law. For 7 years, we've seen the same pattern: rising premiums, dwindling options, broken promises, and a collapsing system. In the state of Indiana, 4 insurers left the Obamacare exchange just this year in the past 3 months, forcing 68,000 Hoosiers to shop for a new plan, making it even harder for them to choose and keep their doctor. But today we have the opportunity to repeal Obamacare and replace it with a patient-centered system, lowering cost, increasing choices, and providing real protection. This legislation dismantles Obamacare's burdensome taxes, mandates, and the job-killing medical device tax. It gives individuals and families access to quality, affordable health care through refundable tax credits and expanded health savings accounts. It provides resources for states to tailor solutions to the needs of their citizens, protecting women's health, addressing the opioid crisis. It gives states flexibility to become innovative reforms and allows my home state to continue building on its patient-centered Healthy Indiana plan. And it protects patients with pre-existing conditions and ensures a stable transition so no one has the rug pulled out from underneath them. With the American Health Care Act, we're delivering on our promise and acting on the policies of President Trump. This bill is just the first step in a 3-part effort to repair our nation's healthcare system. Coupled with administrative actions and additional legislation, the AHCA will lower costs and build a marketplace with real choices instead of a one-size-fits-all plan. Mr. Speaker, 7 years of Obamacare is long enough. 7 years of families seeing their premiums rise, plans canceled, and doctors dropped is enough. Today we can deliver on our promise and put our bold solutions into decisive action. The AHCA is a bill 7 years in the making, and I urge my colleagues to join me in supporting it. Thank you, and I yield back.
Gentlelady's time is expired. Gentleman from Texas reserved. Gentleman from Massachusetts recognized.
Mr. Speaker, I remind my colleague that her vote for this bill will result in 42,000 people in her congressional district in Indiana losing their health care coverage and care. I also ask unanimous consent to enter into the record a letter from the Republican Governor Snyder of the state of Michigan raising his concerns about this legislation.
Without objection.
Mr. Speaker, now I would like to yield 2 minutes to the gentleman from New Jersey, who is a well-regarded member of the Ways and Means Committee, and I think it's fair to say that everybody in this institution looks forward to his time when he gets up to speak.
Gentleman from New Jersey is recognized for 2 minutes.
The question I get asked, Mr. Chairman, is what the heck were they thinking about? Let me tell you what they're thinking about. Medicaid is the source of 25% of all projected public and private spending for drug abuse treatment. It's about $8 billion. Let's consider James Suber from my hometown of Paterson, New Jersey, 1T. Mr. Suber began seeking treatment when New Jersey expanded its Medicare program and provided more comprehensive access to treatment. At least New Jersey got it half right. Each morning, Mr. Suber receives treatment at Paterson Counseling Service, which allows him to go to work as a cleaner at Well of Hope, another treatment center in Paterson serving the homeless. Without the treatment he receives through Medicaid, he wouldn't be working. He would be using the emergency department at St. Joseph's Hospital, the most expensive part of the hospital. Or maybe he wouldn't have survived. So, Mr. Chairman, for the life of me, I don't understand why we would jeopardize treatment for James and the millions of other Americans facing similar challenges. What were they thinking? Will this bill improve Medicaid? Nope. Will the bill increase the number of Americans with health coverage? Nope. Will it lower costs on the exchanges? Nope. Will this bill bolster employer coverage? No. Will coverage now provide more access to care, a promised time and time again by Mr. Trump himself? No. Will it strengthen Medicare? No. Mr. Speaker, it's obvious. We know we're trying to change things and make them better. We changed Medicare. We did it together. We changed Medicaid. We did it together. We changed a lot of things together. But you chose the only lonely path. And, Mr. Chairman, I am happy to yield back to you.
Time's expired. Gentleman from Massachusetts, Representative. Gentleman from Texas. Gentleman from Texas, recognized.
I remind my good friend from New Jersey, 314,000 residents of New Jersey said no thank you to Obamacare because it failed them. I am proud to yield 2 minutes to a new member of the committee who's dived into this issue with great thoughtful and conscientious work. Gentleman from Michigan, Mr. Bishop, 2 minutes.
Gentleman from Michigan is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of the American Health Care Act, and I want to thank the chairman for his leadership on this measure. Mr. Speaker, I came to Washington, D.C. to make a difference. When it comes to health care, it's readily apparent that Obamacare does not work for most Americans. We know as a fact, as we're standing here today, that the current system is collapsing upon itself. Our nation has endured 7 long years of this mess, and today we have the obligation and the responsibility to act. I've heard many critics of this proposal, but I was raised to do what's right, to be a part of the solution and not sit idly by on my hands as a spectator and watch Rome burn. I came to Congress to make a difference, to find solutions to the many issues that vex our country. I came here to reduce the size and scope of government, unwieldy government, to get government out of the way of everyday citizens. I came here to address spending, a $20 trillion debt in this country, to bring back free market principles. I came here to defend the Constitution and our founding principles and turn power back to the states and to the people. All that said, every single one of these principles can be found in this bill. The American Health Care Act reduces spending and cuts the taxes that have strangled businesses and individuals for the last 7 years. It represents the first real entitlement reform in the 52-year history of Medicaid. It deletes federal mandates that rob citizens of their individual liberty. Mr. Speaker, this bill may not be perfect, but it is a dramatic step in the right direction. And before I'm lectured as to what these unsubstantiated facts and fear taxes as to how this is going to impact my state, I would suggest to you that 420,000 Michiganders eligible for Medicare said thanks but no thanks to the broken promise of affordable health care. And that's why, Mr. Speaker, I'm going to vote for this bill, and I would ask my colleagues to support, and I yield back.
The gentleman yields back. The gentleman from Texas reserves. The gentleman from Massachusetts is recognized.
Mr. Speaker, I would remind my colleague that in his vote for this bill will result in 38,200 people from his congressional district in Michigan losing their health care coverage, and 628,000 people in the state of Michigan indeed did sign up for the Affordable Care Act. Mr. Speaker, I'd like to yield 2 minutes to the gentleman from New York, a longtime friend, a very sound member of the committee, and also the well-regarded chairman of the Democratic Caucus, Mr. Crowley, for 2 minutes.
The gentleman from New York is recognized for 2 minutes.
I thank the gentleman for yielding me this time. This bill is a bad policy built on horrible process. 24 million Americans will lose their coverage if this bill becomes law. Premiums and out-of-pocket expenses will skyrocket, especially for older Americans because of the age tax, as hardworking Americans are forced to subsidize tax cuts for the wealthy. It's no wonder this bill was crafted in the dead of night behind closed doors. It's so bad, even members of your own party are rejecting this bill. But President Trump and Republican leadership insisted they need to repeal Obamacare at any cost, even if the price will be making health care out of reach for veterans, for seniors, and many of the hardest working Americans. So the majority made it worse, and then they made it worse again. Now they've taken away the bare minimum requirements for insurance, like covering emergency room visits for prescription drugs. It will crush any protections for pre-existing conditions. There's no guarantee the treatment you need for your condition will even be covered under this bill. Imagine that, health care coverage that doesn't cover your health. insurance that ensures absolutely no peace of mind for what life may bring you. This body blow to critical health protections was done just to win votes, like so many of the other provisions and political favors, like the Empire State Kickback, the Buffalo Bribe, the Syracuse Sellout. I call it simply a political ploy. That provision, which will cut $2 billion from only New York State, has been blasted by newspapers from Buffalo to Newsday on Long Island. They've called it a train wreck. They've called it bloody money. Like everything else in this bill, it represents the worst kind of backroom shady maneuvering. This bill is bad for New York, bad for the democratic system, and bad for America. My colleagues on the other side of the aisle should be ashamed of themselves, and I know many of you are. But this bill is appalling, and I urge everyone in this chamber to vote it down. And, Mr. Chairman, I know that 2.7 million New Yorkers
New York's
will
time
lose
has
their
expired.
health care if this bill becomes law.
The gentleman is no longer recognized. Gentleman from Massachusetts, gentleman from Texas, recognized.
I remind my friend from New York, nearly 4 out of 5 New Yorkers said no to Obamacare because it failed them. Regular order.
The House will come to order.
4 out of 5. I'm proud to yield 1 minute to my dear friend from Iowa, Mr. King.
The gentleman from Iowa is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Chairman, thanks for yielding to me. 7 years ago today, I brought the first repeal of Obamacare here to this Congress. 40 words to rip it out by the roots as if such act had never been enacted. I'd like to be here today passing the full repeal of Obamacare. We're not, but this is the first bite at the repeal apple in a process to hopefully get all of this thing done one day. If I thought we could do it all in one bite, I would stand for that. But instead, here's what we've got. We've got a $1 trillion tax cut. We've got a $1.15 trillion spending cut. We've got a $150 billion deficit reduction. We've got a bill that eliminates the employer mandate, eliminates the individual mandate, and it eliminates federal mandates in the essential health benefits package of those 10 mandates that I despise, by the way. It expands health savings accounts, doubles them, and it allows for us to pass selling insurance across state lines, and it enables catastrophic health insurance. That's a pretty good list. And that's the list of things that I'm going to support here when this goes up for a vote. Mr. Speaker, I yield back the balance of my time and urge its adoption.
The gentleman yields back. Gentleman from Texas Reserve. Gentleman from Massachusetts.
Mr. Speaker, I remind my colleague that his vote for this bill will result in 40,900 people from his congressional district in Iowa losing health care coverage. And I also want to thank the gentleman for being the first speaker on the Republican side to acknowledge that this is a tax cut. Now I'd like to yield 1 minute to the gentleman from Chicago, Illinois, a distinguished member of the Ways and Means Committee and my friend, Mr. Davis.
The gentleman from Illinois is recognized for 1 minute.
Thank you, Mr. Speaker, and I thank the gentleman for yielding. I rise in strong opposition to this draconian, Dracula-inspired health bill. It's not really a health bill at all. As a matter of fact, it is a tax cut for the wealthiest individuals in our country. This bill will decimate all of the public health gains that professional health personnel and activists have fought for the last 50 years. This bill will take out the opportunity for those low and moderate income individuals who fall between the gap created by Medicaid and nothing. They are the least of those in our society. And when you take away health care for that group of individuals, history will not regard you well. I believe that the best way to measure the effectiveness of a society is by how well it treats its young, how well it treats its old, and how well it treats those who have difficulty caring for themselves. I will vote no, urge us all to do so.
Gentleman's time has expired. Gentleman from Massachusetts, time reserved. Gentleman from Texas, recognized.
Yes, Mr. Speaker, I remind my good friend from Illinois, 500,000 Illinoisans have said no to Obamacare because it failed them. I reserve that.
Gentleman from Texas, reserved. Gentleman from Massachusetts.
Mr. Speaker, now it's a pleasure for me to introduce and acknowledge and yield 2 minutes to the gentlelady from California, Ms. Sanchez, the Vice Chairman of the Democratic caucus and a very, very strong performer on the Ways and Means Committee. Ms. Sanchez.
Gentlelady from California is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in opposition to the Republicans' so-called health care bill. It pains me to even call it a health care bill because it's actually a massive tax cut for insurance CEOs that provides nearly zero health care benefits for the American people. In fact, Trump Care ensures that 24 million Americans will lose their health insurance coverage. Seniors will be charged more, and insurance companies will once again dictate the health of the American people. On the very day that the majority tax cuts for the rich come into effect on January 1st, 2018, at least 40,000 of my own constituents would immediately lose their health care. But that's not all. The Republican idea of health coverage will leave millions of Americans without the basic health services that they expect and that they deserve. That means that the monthly premium you pay won't cover all the services you will need to get better if you get sick. The Republican health care plan won't cover your emergency room visit, the x-rays, or even the prescription drugs you need to recover. Heaven forbid if you need prenatal or pediatric care too. Basically, under this plan, one illness is enough to bankrupt a family for a lifetime. If you asked anyone on the street, no one in America would call this health insurance. And yet my Republican colleagues hail this as choice. The choice to go bankrupt if you get sick or, God forbid, have an accident. So, Mr. Speaker, I have to ask, how many Republicans are left that actually support the bill? Who wants to kick thousands of people off of Medicaid, reduce care for the disabled, and strip children of their health care? Because that's exactly what you're going to do if you vote for this bill. It does the exact opposite of what you, your party, and President Trump have promised the American people. This bill doesn't provide better, cheaper health care for everyone. And guess what? Everybody knows that. By voting for this bill, you will literally force millions of Americans to pay more for less and jeopardize the health of our country for generations. So if you vote to break all the promises you made to the American people, then you're going to own it and you're going to be responsible for whatever happens. Vote down this bill.
The gentlelady's time has expired. Gentleman from Massachusetts reserved. Gentleman from Texas.
I reserve, Mr. Speaker.
Gentleman from Texas reserved. Gentleman from Massachusetts.
With that, Mr. Speaker, I'd like to introduce the gentlelady from Alabama, a valued member of the Ways and Means Committee, Ms. Sewell, for 1 minute.
Gentlelady from Alabama is recognized for 1 minute.
Mr. Speaker, for 7 years, our Republican colleagues have railed against the Affordable Care Act. But is this the best they can offer now? Trump Care? The Republican bill, Trump Care, is a bad deal for Americans, and it's a bad deal for Alabamians. By every matrix, cost, coverage, and care, it is a bad deal. On costs, Trump Care will cost more and give us less. For Alabama hospitals, Trump Care will mean a $97 million increase in uncompensated cost care. And it is an age tax for seniors. Seniors will pay 5 times more than the young for their health insurance. On coverage, Trump Care will mean 24 million Americans and 243,000 Alabamians will lose their health care coverage. On quality of care, Trump Care will mean that essential benefits will be lost. Essential benefits like rehabilitative care, mental health, and preventive services. Mr. Speaker, what is clear, Trump Care is not a health care bill. It's a tax cut for the wealthy bill. $600 billion in tax cuts. So I say to you, my Republican colleagues know what they're against, the Affordable Care Act. But what
The
are they
gentlelady's
for?
time has expired.
What are they for? I ask
The
all of you
gentlelady's
to
time
vote
has expired.
against
The
this
gentlelady is no
horrible
longer
bill.
recognized. The gentleman from Massachusetts reserves. The gentleman from Texas.
Mr. Speaker,
Gentleman reserved. The House will come to order while members are speaking from the well or from the podiums. The members are reminded to take your conversations off the floor, take your conversations off the back rail on both sides and in the aisle. Please maintain order while members are speaking. The gentleman from Texas is recognized.
reserved, Mr. Speaker.
Gentleman from Texas reserved. Gentleman from Massachusetts.
Mr. Speaker, might I inquire as to how much time remains?
Certainly. The gentleman from Massachusetts has 5 1/4 into this committee time slot.
Thank you, Mr. Speaker. With that, I would like to acknowledge a new member of the Ways and Means Committee, a very thoughtful member of the Congress, Ms. Chu from California, for 1 minute.
For 1 minute. The gentlelady from California is recognized for 1 minute.
My constituent Patty never had to worry about health care. Her husband had insurance through his job. But last year, Patty's husband passed away suddenly. Overnight, Patty found herself without health coverage for herself and her 20-year-old son, who had a pre-existing condition. Even though she was grieving over the sudden loss of her husband, Patty couldn't afford COBRA and had less than a month to find health care for her family. Thank goodness she was able to get coverage through the ACA. But under Trump Care, Patty could have her life upended all over again. Patty is 62 years old, and Trump Care would cause premiums for people over 60 to increase by more than $6,000 a year, making insurance unaffordable. And under the age tax created in this bill, insurance companies could charge Patty 5 times as much as a young person. She could see skyrocketing costs for her hypertension and doctor's visits. Trump Care is a bad deal for Americans like Patty. I urge my colleagues to vote a resounding no to this downright cruel bill.
Gentlelady's time has expired. Gentleman from Massachusetts reserved. Gentleman from Texas.
Reserved.
Gentleman from Texas reserves. Gentleman from Massachusetts.
Mr. Speaker, with that, I'd like to introduce the gentleman from Oregon, a very thoughtful member of the Congress and a good friend to me, Mr. DeFazio, for 1 minute.
Gentleman from Oregon is recognized for 1 minute.
Thank the gentleman. In this so-called health bill, which is actually just mostly targeted for tax cuts for the wealthiest among us, let's look at it this way. A millionaire will get a $30,000 a year tax cut. A 64-year-old senior who earns $30,000 a year, that's all he earned, just the tax cut the millionaire gets, they will see their premium go from $1,700 a year to $15,000 a year, half their income. Yeah, they're going to have a choice. Give up their house so they can buy health insurance, or don't buy health insurance, pray you don't have a health emergency, and go bankrupt or die. Those are great choices. This says a lot about the values of the Republican leadership in their obsession. Instead of fixing the problems with the Affordable Care Act, they want to kill it. It says a lot about your values. They're pathetic.
Gentleman's time has expired. Gentleman from Massachusetts reserves. Gentleman from Texas reserve. Gentleman from Massachusetts.
Thank you, Mr. Speaker. With that, I would like to yield 1 minute to the gentleman from Arizona, Mr. O'Halloran, for 1 minute.
The gentleman from Arizona is recognized for 1 minute.
Thank you, Mr. Speaker. I rise in strong opposition to the so-called American Health Care Act. I am alarmed at the real consequences this bill will have on rural Arizona and rural America. These communities will be disproportionately harmed by this bill. In Coconino County, a 40-year-old making $30,000 a year will go from a $2,400 payment to a $6,000 payment. But getting away from my script for a second, I spent many years on the west side of Chicago looking at the core sign of poverty looks like. Night after night, family after family, in our cities, in our towns, this wonderful America. And I know a little bit about math. And I know that 20 million people insured is better than 24 million people uninsured. Thank you, and please vote no.
Gentleman yields back. Gentleman from Massachusetts reserved. Gentleman from Texas reserved. Gentleman from Massachusetts now is recognized.
Mr. Speaker, I'd like to yield 30 seconds to a friend of mine, the gentleman from Tennessee, Mr. Cohen, for 30 seconds.
The gentleman from Tennessee is recognized for 30 seconds.
Thank you, sir. This is not a health care bill. This is a wealth care bill. Unfortunately, President Trump, when he spoke in Louisville, he said we had to pass this bill to get to big tax cuts. It's about wealth care. It's the Ebenezer Scrooge law of this Congress. The insurance you'll get with the amendments made will be as worthless as a degree from Trump University. We need wealth care, not wealth care, but we need health care. I yield back the balance.
Gentleman yields back. Gentleman from Massachusetts reserves. Gentleman from Texas reserves. Gentleman from Massachusetts.
Mr. Speaker, might I inquire of the chairman as to his intentions, as to what he intends to do with closing?
Yes, I am ready to close when you are, sir.
Gentleman from Massachusetts.
If the gentleman is prepared to close, Mr. Speaker, I'm prepared to close on our side.
Okay. Has 1 minute and 3/4. Gentleman is recognized for the 1 minute and 3/4.
Thank you, Mr. Speaker. I want to make sure the people of America understand what we're doing here in about 1 hour. We heard during the course of a presidential campaign the promise that everything was going to be covered and we'd be tired of winning. If winning means that 24 million Americans are going to lose their health care coverage, if winning means that imposing an age tax on seniors, if winning means higher out-of-pocket costs for working Americans, and if winning means robbing $75 billion from the Medicare Trust Fund, we don't want to be part of that victory lap. This isn't about one person making up alternative facts. Our statements today have been based upon the CBO, the National Rural Health Association, the American Medical Association, the American Association of Retired Persons, and the March of Dimes. Fewer covered, weaker protections, higher costs. Let's call this what it is today. It is a $1 trillion tax cut for the richest amongst us. They are now facing the art of the ordeal. They have a bad plan and they know it, and they've scrambled for the last week to try to figure out how to stitch it together, and it hasn't worked. So for those across this country, think of the following: no maternity care, fewer hospital visits, no mental health services for those families that are struggling with a family member who has opiate addiction, which is the crisis of our time. This is more of the same: tax cuts for the wealthiest amongst us and health care cuts for everyone else. And I yield back the balance of my time.
Gentleman yields back. Gentleman yields back. The gentleman from Texas is recognized. Gentleman from Texas is recognized.
Mr. Speaker, I yield myself as much time as I may consume.
Gentleman is recognized for as much time as may consume.
You want to know how bad Obamacare is? Twice as many Americans have exempted themselves, have paid a fine, or found another way out of Obamacare for everyone who took it. I am a conservative, and I'm proud of the conservative wins in this bill. I'm proud of the $1 trillion in tax relief on our small businesses, our patients, and our families. I'm proud of the more than $1 trillion of spending cuts that Washington cannot afford nor sustain. I'm proud of the first reforms of Medicaid since the program was created, and giving states back control of that plan, including the option of a work requirement. I'm proud to repeal Obamacare mandates that forced Americans into health care they can't afford and don't want. I'm proud to defund Planned Parenthood once and for all, and I'm proud of the $150 billion of deficit reduction. This is a clear choice, and we will stand where we stand today. The choice between President Trump and more freedom or Obamacare and less freedom, I stand with President Trump. I yield back.
Gentleman, time has expired. Gentleman, yield back. What purpose does the gentlelady from Tennessee seek recognition?
Mr. Speaker, on March the 7th, 2017, Dr. Tom Price, the Secretary of Health and Human Services, sent a letter of support for the American Health Care Act to Chairman Walden and Brady, and I ask unanimous consent to submit this letter into the record.
Without objection.
Mr. Speaker, I yield myself as much time as I may consume.
The gentlelady is recognized for as much time as she may consume.
Thank you, Mr. Speaker. And I would like to submit for the record a letter that comes from 24 of our governors in support of the repeal of Obamacare, and I would like to read just 2 quick paragraphs out of the letter. The letter reads, we support efforts to reform the system, repeal Obamacare and reform the system to provide access to affordable and quality health care. We must reform the system. We must support a plan that gives state governments maximum flexibility to reform Medicaid and the system surrounding it. The states are more effective, more efficient, more accountable to the people. What works in one state may not work in another location, and the true form will allow states to recognize and meet the unique needs of the people across America. We recognize that a vote in the House of Representatives is the first step in the repeal and replace and reform process. The members of the United States Senate will undoubtedly make additional improvements before final approval by the President. We also recognize that the Secretary of Health and Human Services is committed to working with state leaders to provide maximum flexibility to true reform. And I ask unanimous consent to submit this for the record. I also ask unanimous consent to support for the record groups supportive of the American Health Care Act. We have many groups, from the conservative groups to pro-life groups to industry groups, and among those would be several insurance providers such as Blue Cross and Blue Shield and Anthem and others.
Without objection. The House will come to order. If members are sitting in the chamber and choose to speak and talk, please take your conversations off and have respect for those that are speaking on both sides of the aisle during this debate. For what purpose does the gentlelady from Ohio seek recognition?
Yes, Mr. Speaker, I ask unanimous consent to place remarks in the record against this Trump wealth care bill.
Without objection. Gentlelady from Tennessee.
Thank you, Mr. Speaker. And it is now my pleasure to give 2 minutes to the gentleman from Texas, Mr. Hensarling, the chair of the Financial Services Committee.
The gentleman from Texas is recognized for 2 minutes.
Mr. Speaker, tragically, I receive correspondence every week like this. I heard from Rita in East Texas, who writes me, since Obamacare took effect, my insurance no longer covers my colonoscopies as preventative care. I now pay $1,000 and more out of pocket versus a $100 outpatient fee. I heard from Frances in the Dallas area, near where I live. A few years ago, she was tragically diagnosed with tonsil cancer. The good news is she had a good policy, $600 a month premium, maximum out of pocket $3,500. But thanks to Obamacare, her insurance company dropped her twice. And as she wrote, quote, they dropped me again because they're leaving the Dallas market. Her premiums and deductibles doubled. She lost her oncologist, and she writes me, this is all because of Obamacare Affordable Care Act. I heard from Tanya in Van Zandt County in my district. We had 5 family members covered by insurance at around $800 a month until Obamacare. Our insurance premium skyrocketed to $1,500 a month, equivalent to a house payment, with a $15,000 deductible, and we cannot see the doctors that know our medical history. She says, repeal it. I should not be forced to pay for something I cannot use. This has been a nightmare. Mr. Speaker, Obamacare has been a nightmare. It is collapsing as we speak. People are losing their coverages. Insurance plans are pulling out of states and counties. Tens of millions of our fellow countrymen have been forced to buy health insurance plans they cannot afford, they do not want, and do not work for them. Right here, right now, we have a choice: failed Obamacare or the American Health Care Act that begins the process of providing Americans with guaranteed access to quality, affordable, patient-centered health care. It clearly advances the cause of freedom, and all members should support it and end the nightmare of Obamacare.
Gentleman's time has expired. The gentlelady from Tennessee reserves. The gentleman from Virginia is recognized.
Mr. Speaker, I ask unanimous consent that I be allowed to manage the remainder of the time.
The gentleman is recognized for that purpose.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Mr. Speaker, as we talk about the Affordable Care Act, I think it's important to remind ourselves of the situation before it passed. Costs were going through the roof. Those with pre-existing conditions could not get insurance. Women were paying more than men, and every year millions of people were losing their insurance. We passed the Affordable Care Act, and since then the costs have continued to go up, but at the lowest rate in 50 years. Those with pre-existing conditions can now get insurance at the standard rate. Women are no longer paying more than men, and instead of millions of people losing their insurance every year, more than 20 million more people now have insurance. Now, the full name of the Affordable Care Act is the Patient Protection and Affordable Care Act, so now your coverage can't be canceled if your insurance company decides that it's paid too much. Preventive services such as cancer screenings are free with no copays and deductibles. We're closing the donut hole. Those under 26 can stay on their parents' policies. We funded community health centers, made investments in education to produce more doctors, nurses, and other professionals. And through all of that, the Medicare Trust Fund is more solvent than it was before. Still, the law is not perfect. But if we're going to make any changes, we ought to improve the law, not make it worse. Incredibly, this bill makes it worse. And now the CBO has separated promises and press releases from reality. 24 million fewer people will have insurance, and our Republicans call this choice and freedom to be uninsured. Most everybody else will pay more and get fewer benefits. All of those consequences will occur if the proposal actually works. A number of states have done what this bill tries to do, and that is cover people with pre-existing conditions without universal coverage. All of those attempts failed. And so the question we must ask is, who will be better off if this bill passes? Certainly not older people who will face the bill's age tax. Certainly not veterans who will lose benefits. Certainly not senior citizens in nursing homes and people with disabilities because Medicaid is cut. Even the solvency of the Medicare Trust Fund will be worse. But millionaires will get tax cuts. Mr. Speaker, we've been hearing a lot of complaints and shortcomings about the Affordable Care Act. But if we're going to make any changes, we should improve it. Unfortunately, this bill makes things worse. 24 million will lose their insurance. Most everybody else will pay more and get less. This bill should be defeated. I've reserved the balance of my time.
Gentleman from Virginia reserved. Gentlelady from Tennessee is recognized.
Thank you, Mr. Speaker, and it is now my honor to yield to the gentleman from Virginia, the distinguished chairman of the Judiciary Committee, Mr. Goodlatte.
For how long are you yielding?
For 2 minutes.
Gentleman from Virginia is recognized for 2 minutes.
Thank you, Madam Chairman. Mr. Speaker, I want to tell you why I'm supporting this legislation, the American Health Care Act. Kay from Roanoke contacted me about the President Obama's promise that she could keep her health care. She shared that she received a letter from her insurer stating that her policy was going to increase by $600 per month. Increase by $600 per month. Since she wasn't of age to be on Medicare but wasn't working because she was at home caring for her sick husband, she was frustrated with her situation. Kay couldn't afford the extra money she owed on top of the bills for her husband's medical treatment. She told me, quote, "So I will now have to pay the fine, drop my insurance, and hope I do not get sick." I told Kay I would vote to repeal and replace Obamacare. A nurse from Warren County wrote to me, "The care that I give my patients is founded on their ability to choose their course of care. We advocate every day for our patients to have more choices in their care, and it will be very painful for us to deny them those options and to deny them care." She asked me to stand against Obamacare, and I told her I would. Susan from Bedford County told me her health insurance premium increased 156%, and her deductible increased 766% in just 2 years. She asked how we could make her pay such high rates. I told Susan I'd vote to repeal Obamacare. Mr. Speaker, I told my constituents that I would stand for them to repeal this law that has hurt their ability to get the affordable care they want and need. Passing the American Health Care Act is the first step in repealing Obamacare and replacing it with solutions that put patients first. I urge my fellow members to support this bill. Obamacare has failed far too many in the 6th District of Virginia. The status quo cannot continue. I yield back.
Gentleman yields back. The gentlelady from Tennessee reserves. The gentleman from Virginia is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I remind my distinguished colleague from Virginia that his vote for this bill will result in 56,100 more people from his congressional district in Virginia losing health care. Mr. Speaker, I yield 1 minute to the gentleman from the Mariana Islands, Mr. Sablon.
The gentleman from Mariana Islands is recognized for 1 minute.
Mr. Speaker, I oppose the American Health Care Act because it fails to increase coverage for 3.8 million Americans in the insular areas, American Samoa, Guam, the U.S. Virgin Islands, Puerto Rico, and my own district, the Mariana Islands. President Trump promised, and I quote, "Everybody is going to be taken care of much better than they are taken care of now," end quote. But that is not happening. Instead of taking the opportunity to take care of all Americans, the American Health Care Act ignores the insular areas. We're not included in the new Medicaid per capita funding proposal. As a matter of fact, in a year, we would have shared Medicaid funding reduced by 68%. We're not included in the new Patient and State Stability Fund. And the new tax credit for insurance premiums is actually a new cost, an unfunded federal mandate imposed by Congress on territorial governments. Everyone in this chamber wants affordable quality health care for all Americans. This bill fails to do that. So let us begin again. Let us work together on legislation to reach goal the President has set and many of us share. Insurance for everyone, not just
The gentleman's
rich.
time has expired. The gentleman from Virginia reserves. The lady from Tennessee is recognized.
Thank you, Mr. Speaker. And I now yield 1.5 minutes to the distinguished member from Florida, Dr. Dunn.
The gentleman from Florida is recognized for 1.5 minutes.
Thank you, Madam Chair. Mr. Speaker, I rise to repeal Obamacare by supporting the American Health Care Act. We are here to take health care back from the bureaucrats and give it to the people. The previous administration enacted Obamacare, and we saw its effects: higher premiums, less choice, lost coverage, and broken promises. The deductibles are so high, it's like not having insurance at all. The people who sent me to Congress sent me with strict orders: end this law. And on the American Health Care Act, I can report it does. With this bill, the federal government no longer forces you to buy a product you can't use and don't want. The individual mandate is gone, so is the job-killing employer mandate. Gone are a host of taxes on prescription meds, over-the-counter drugs, insurance premiums, and life-saving medical devices. It ends Obamacare's Medicaid expansion, and it puts Medicaid on a budget and focuses state efforts on those people truly in need. This is the biggest entitlement reform in a generation. Of course, the bill is not perfect. There's more to do, but I spent 30 years as a surgeon. In medicine as in life, you do not get to choose the perfect option. You learn not to make perfect the enemy of great. With this vote, we decide whether Obamacare is our health care future or not. We can live with its failures and broken promises, or create a market-based system that actually lowers the cost of health care, serves patients, not bureaucrats. I support the American Health Care Act, Mr. Speaker, and I urge that all members do the same. I yield back.
The gentleman from Florida yields back. The gentlelady from Tennessee reserves. The gentleman from Virginia.
Thank you, Mr. Speaker. I remind my colleague that his vote for this bill will result in 63,900 people from his congressional district in Florida losing health care coverage and care. And I now yield 1 minute to the gentleman from Connecticut, Mr. Courtney.
The gentleman from Connecticut is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, in a few minutes, the American people will see clearly what each and every member of this House is made of. Will we vote to willfully strip health care coverage for 24 million Americans, older Americans, working Americans, Americans with chronic illness and developmental disabilities, and now, incredibly, we even know Americans who wore the uniform of this nation? In a few minutes, we will see who will vote to raid the Medicare Trust Fund in order to cut Medicare taxes for the rich, and we will see who will vote to cut Medicaid's coverage for patients struggling with the curse of opioid addiction. Mr. Speaker, this is not just a vote. This is a gut check of who we are as people, and whether our purpose as elected officials is to serve the public interest or rather feckless special interests. Show the nation that we care more about people than politics, that we care more about the long arc of American history toward justice rather than the short news cycle of who's up and who's down in Washington. Make no mistake, history is watching this vote. Vote no. I yield back.
Gentleman yields back. Gentleman from Virginia reserves. Gentlelady from Tennessee.
Thank you, Mr. Speaker. And it is my honor now to yield 1.5 minutes to the gentleman from Louisiana, who is a family practitioner and knows a little bit about medicine, Dr. Abraham.
Thank you,
Gentleman
Madam Chair.
from Louisiana is recognized for 1 minute now.
Thank you, Mr. Speaker. As a practicing physician in the Louisiana and Mississippi Delta, I have some of the best patients, but some of the poorest. But they can't afford to see me because they can't afford Obamacare, increased costs, skyrocketing premiums, high deductibles. I can't cure a disease if I can't see the patient. The cost is just too high for Obamacare. We've heard about Medicaid expansion here today. That is a second-class insurance for first-class people. I can't get my patients to see a specialist. They have to go to the hospital. They have to go to the emergency room. Prices go out the roof. I've heard my colleagues on the other side of the aisle reference the Hippocratic Oath. With all due respect, I don't think they would know what the Hippocratic Oath says if their life depended on them. Guess what? It does. Google it. Let me educate you. Let me educate you.
House will come to order.
Let me educate our colleagues. It says, I will always seek a path to a cure for all diseases. Obamacare will not let me do that. We've got to do better. We cannot cram people into a healthcare system that has failed just so politicians can thump their chest and have some type of mysterious victory that is hollow and very, very small. We need to pass this American Health Care Act. Obamacare has failed. It's a sham of an insurance. Americans deserve better. We deserve better. As Americans, my patients deserve better. Thank you, Mr. Speaker. I yield back.
Gentleman yields back. Gentlelady from Tennessee reserves. Gentleman from Virginia.
Mr. Speaker, I remind my colleagues that his vote for this bill will result in 51,700 people in his district losing their coverage and care. And Mr. Speaker, I'd ask unanimous consent to enter into the record at this point a letter from the American Academy of Family Physicians, American Academy of Pediatrics, American College of Physicians, American Congress of Obstetricians and Gynecologists, and the American Osteopathic Association in opposition to the legislation.
Without objection.
Mr. Speaker, I yield 1 minute to the gentlelady from Ohio, Ms. Fudge.
Gentlelady from Ohio is recognized for 1 minute.
Thank you, and I thank the gentleman for yielding. Mr. Speaker, what is a life worth? What does it cost to save the life of a sick child or a senior citizen? For all of the rhetoric about freedom and choices, this bill sends a clear message to every American as to where Republican priorities lie. Tax breaks to the wealthy have been deemed more valuable than life-saving care. They are telling hardworking families that insurance that only benefits the wealthy, the healthy, and the young is more important than access to nursing homes, to pediatric care, mental health services, substance abuse treatment, and the overall peace of mind that if you get sick, you can afford care. Speaker Ryan calls this an act of mercy. This is by no means merciful, Mr. Speaker. Mercy is caring for the sick, the poor, for our elders. Mercy is extending a hand to those in need. This is heartless. Human decency demands a no vote on Trump care. Vote no. I yield back.
Gentlelady yields back. Gentleman from Virginia reserves. Gentlelady from Tennessee.
Thank you, Mr. Speaker. And it's now my honor to yield 2 minutes to the gentleman from Texas, the chairman of the Agriculture Committee, Mr. Conway.
Gentleman from Texas recognized for 2 minutes.
Thank you, Mr. Speaker. Appreciate the lady yielding. Mr. Speaker, we're faced with an unenviable choice of the facts that there are infinite demand for health care. There is no top on the amount of health care costs necessary to provide all the health care that we want for everybody in this country. And we have limited resources within which to do that. The real question is, does Obamacare to take up that task by asking government to make those hard choices? Or do we as individuals and families and caregivers make those harder choices for ourselves? I believe that the bill that we'll get to vote on today moves us toward that direction. This isn't about health care per se. This is about how do you pay for it. Insurance is not a magic bullet anywhere across the spectrum. Insurance is simply a scheme in which we risk manage together. We put a certain amount of money into a bucket, assuming not all of us will have the risks or suffer the risks that we want to cover. And if we do, we got to put more money in. If we don't, then the system works. And this is about having to confront that choice that there's way too much costs for the amount of resources that are available in any circumstances. And it's hard. Many of my constituents ask, why did Republicans have spent 6 years railing against Obamacare and not have the fix available on inaugural day? Well, this is Exhibit A. This is hard stuff. It's, even among Republicans, we've got more than 218 votes among us, and we can't agree among ourselves necessarily what ought to go forward. But I do know this, that we're down to the final choice. Do we keep Obamacare and the failure that is confronting us and will continue to be there, or do we take a chance on moving forward something different, moving toward freedom, moving toward choice, giving states back the opportunity to decide for their indigent population, how should they take care of them? I don't think anybody in Washington, D.C. can come up with a plan that fixes that for all 50 states. I trust my colleagues in Austin to make that happen far better than anybody I would trust in D.C. And this bill moves that direction, and that's the right direction for it to go. This is a hard choice, but for me, it's relatively straightforward. You keep Obamacare with a no vote, you move toward a brighter future for health care in this country and the way we pay for it, who pays for it, and how we get that done by a yes vote. And I encourage my colleagues to vote yes on this bill, and I yield back.
Gentleman yields back. Gentlelady from Tennessee reserves. Gentleman from Virginia is recognized.
Mr. Speaker, I remind my colleague that his vote for this bill will result in making things worse by 58,600 people in his district losing their health care coverage and care. Mr. Speaker, I yield 1 minute to the gentlelady from Florida, Ms. Wilson.
Gentlelady from Florida is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, I would like to begin by asking my Republican colleagues one simple question. Don't you have constituents who get sick and need insurance? Everyone gets sick, rich and poor, black and white, men, women, and children. And having insurance gives us peace of mind. It helps ensure that a medical crisis is not exacerbated by a financial crisis. It often makes the difference between life and death. If the Affordable Care Act is repealed, your constituents and millions of people will be kicked off the insurance roll, and that is a shame. They will suffer, and their families will suffer. I have health insurance, and so does every member of Congress. We even have a clinic and doctors at our disposal right here in this Capitol. Doesn't every American deserve the same treatment as members of Congress? Instead of moving backwards, Republicans should partner with Democrats to amend and strengthen the existing law. By working together, we can create a plan that works for all Americans, not just members of Congress. Vote no, vote no.
Gentlelady's time has expired. Now, pursuant to Clause 1C of Rule 19, further consideration of H.R. 1628 is postponed. Pursuant to Clause 12A of Rule 1, the chair declares the House in recess subject to the call of the chair.